What is the rice method?
The rice method is a simple first aid strategy used to treat minor injuries like sprains, strains, and bruises. RICE stands for rest, ice, compression, and elevation. This method helps reduce pain, swelling, and further damage, making it a popular approach for sports and everyday injuries. Understanding each step helps you recover faster and more safely after minor accidents.
Rest, why taking a break matters.
Rest is the first step in the RICE method. After an injury, stopping activity prevents further harm and gives your body time to heal. Avoid putting weight or stress on the injured area, especially in the first 24 to 48 hours. Rest allows tissues to repair, reduces inflammation, and sets the foundation for safe recovery.
Ice, cooling down inflammation.
Applying ice helps control swelling and numb pain. Place a cold pack or a bag of ice wrapped in a thin cloth on the injured area for 15 to 20 minutes. Repeat every 2 to 3 hours, especially during the first 48 hours after injury. Avoid placing ice directly on skin to prevent frostbite or irritation.
Compression, reducing swelling.
Compression involves wrapping the injury with an elastic bandage or support to limit swelling. Make sure the wrap is snug but not too tight. Cutting off circulation can cause further injury. Compression helps stabilize the affected area and controls fluid buildup, keeping swelling in check so recovery can progress smoothly.
Elevation, helping fluid drain.
By elevating the injured limb above heart level, you encourage fluids to drain away from the area, reducing swelling and discomfort. Use pillows or cushions for support. Elevation works best when combined with rest, ice, and compression. Keep the injury elevated as much as possible, especially during the first days after it happens.
When to use and not use rice.
The RICE method is best for minor sprains, strains, and bumps. It's not a substitute for medical care in case of severe pain, fractures, or open wounds. If swelling or pain doesn't improve within a day or two, or if you notice numbness or unusual color changes, consult a healthcare professional for further evaluation.